Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on Mektovi. So Mektovi, or Binimetinib, is the generic name for Mektovi. So Binimetinib is an MEK inhibitor. So MEK is an enzyme that regulates the biosynthesis of the inflammatory cytokines, the TNF, IL-6 and IL-1. MEK inhibitors interfere with these biosynthetic processes. It is a chemotherapeutic agent that has anti-tumor activity. So Binimetinib is used in combination with Mektovi to treat a type of skin cancer called melanoma that is spread to other parts of the body or cannot be removed with surgery and has specific BRAF gene mutations. So an important note on this medicine: if a drug has been approved for one use, doctors or consultants may elect to use the same drug for other problems if they believe it may be helpful. So how is Binimetinib given? So Mektovi is a tablet taken by mouth 2 times a day, about 12 hours apart. Mektovi may be taken with or without food. And you take Mektovi exactly as your doctor has prescribed it. Do not change the dose or stop taking it unless your doctor has told you to do so. If you miss a dose of Mektovi, take it as soon as you remember. If it is within 6 hours of your next scheduled dose, take your next dose at your regular time. Do not take or make up for 2 missed doses by taking 2 together. So do not take an extra dose. If you vomit after taking your scheduled dose, take your next dose at your regular time. The amount of Mektovi that you will receive depends on many factors, including your liver function, your general health or other health problems, and the type of cancer or condition you have. Your doctor will determine your exact dosage and schedule. Some of the side effects. So important things to remember about side effects of Mektovi when it's administered with encorafenib. Most people will not experience all of the Mektovi side effects. Side effects are often predictable in terms of their onset, duration and severity. Side effects are almost always reversible and will go away after treatment is complete. So side effects may be quite manageable, and there are many options to minimize or prevent the side effects of Mektovi. So the following side effects are common and occur in greater than 30% of patients taking Mektovi with encorafenib: fatigue, nausea and vomiting, diarrhea, increased serum creatinine. And there are less common side effects that are occurring in 10 to 30% of patients receiving Mektovi with encorafenib: abdominal pain, fever, oedema, constipation, rash, dizziness, visual impairment, bleeding problems, high blood pressure, elevated liver enzymes. So not all side effects have been mentioned here. Side effects that are very rare, occurring in less than about 10% of patients, are not listed or mentioned here. But you should always inform your doctor if you experience any unusual symptoms. So when do you talk or contact your doctor or healthcare provider? So you contact your doctor immediately, day or night, if you experience any of the following symptoms: shortness of breath, wheezing, difficulty breathing, closing up of the throat, swelling of facial features, and hives. The following symptoms require medical attention but are not an emergency. Contact your doctor within 24 hours of noticing any of the following: So shortness of breath, wheezing, difficulty breathing, closing up of the throat, and swelling of facial features. So the following symptoms require medical attention, but are not an emergency. Contact your doctor within 24 hours of noticing any of the following: nausea that interferes with ability to eat and unrelieved with prescribed medicine, vomiting or vomiting more than 4 to 5 times in a 24-hour period, and diarrhea 4 to 6 episodes in a 24-hour period, unusual bleeding or bruising, and black or tarry stools or blood in your stools, coughing up or vomiting blood and blood in the urine, extreme fatigue, and lightheadedness or dizziness, heart pounding or racing, any sudden change in eyesight, so blurred or distorted vision. Also stomach pains, sudden shortness of breath or trouble breathing, pain in the legs without swelling, swelling in arms or legs that occurs in one leg or arm but not the other. Always inform your healthcare provider if you experience any unusual symptoms. So some precautions. Before starting Mektovi treatment, make sure you tell your doctor about any other medicines that you are taking, and these include prescription medicines, over-the-counter medicines, vitamins and herbal remedies. Tell your doctor if you're pregnant or may be pregnant prior to starting this treatment. Mektovi may cause harm to a fetus when given to a pregnant woman. So for women, you use contraceptives and do not conceive a child while taking Mektovi and for 30 days after the last dose of Mektovi. So barrier methods of contraception are recommended. And do not breastfeed while taking Mektovi or for up to 3 days after the final dose of Mektovi. Some self-care tips: if you should experience nausea, take anti-nausea medicines as prescribed by your doctor and eat small, frequent meals. Sucking on lozenges and chewing gum may also help. Drink plenty of water and follow the regimen of anti-diarrhea medication as prescribed by your doctor. Eat foods that may help reduce diarrhea and get plenty of rest and maintain good nutrition. Remain active as you are able. Gentle exercise is encouraged, such as a daily walk. Mektovi can cause visual changes, dizziness and tiredness. If you have any of these symptoms, use caution when driving a car or using machinery or anything that requires you to be alert, and make sure your provider is aware. If you experience symptoms or side effects, be sure to discuss them with your doctor. They can prescribe medicines and or have other suggestions that are effective in managing such problems. So monitoring and testing while taking Mektovi. You will be checked regularly by your healthcare professional while you're taking Mektovi to monitor side effects and check your response to therapy. You will have regular tests to assess your heart, eyes and liver health. You may have blood work done as well. So how does Mektovi work? So it's a targeted therapy, is the result of about 100 years of research to understanding the differences between cancer cells and normal cells. To date, cancer treatment has focused primarily on killing rapidly dividing cells, because one feature of cancer cells is that they divide rapidly. Unfortunately, some of our normal cells divide rapidly too, causing multiple side effects. Targeted therapy is about identifying other features of cancer cells. Scientists look for specific differences in the cancer cells and the normal cells. This information is used to create a targeted therapy to attack the cancer cells without damaging normal cells, thus leading to fewer side effects. Each type of targeted therapy works a little bit differently, but all interfere with the ability of the cancer cell to grow, divide, and repair or communicate with other cells. There are different types of targeted therapies defined in three broad categories. Some targeted therapies focus on the internal components and function of the cancer cell. The targeted therapies use small molecules that can get into the cell and disrupt the function of the cells, causing them to die. There are several types of targeted therapy that focus on the inner parts of the cells. Other targeted therapies target receptors that are on the outside of the cell. Therapies that target receptors are also known as monoclonal antibodies. Anti-neogenesis inhibitors target blood vessels that supply oxygen to the cells, ultimately causing the cells to starve. Mektovi is a targeted therapy that targets the MEK1 and MEK2 protein within the cancer cell. It is usually given in combination with the BRAF or BRAF kinase inhibitor encorafenib. The BRAF gene plays an important role in both normal and cancer cells. This gene leads to the production of BRAF protein, and this protein is normally part of a chain of molecules that relay a signal that tells cells how to grow and divide. A change in the BRAF gene can alter the way the protein works. Instead of waiting for its turn to signal a cell to divide or grow, the BRAF protein is out of control and signals all the time. This out of control BRAF signaling may drive the uncontrolled growth of a cancer cell. MEK1 and 2 are proteins further down the chain of molecules in this pathway. Mektovi interferes with the signal at the MEK1 and 2 part of the chain. This interference may cause a slowdown in the growth of cancer. So that brings this video to an end. If you have any questions, you can contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.